A very good morning to you. I'm very happy to welcome you all to Berlin and this year's Global Health Talk 2025. My name is Corinna Heinecke and I'm the Managing Director of the Secretariat of the Global Health Hub Germany. It was only 7 months ago that we last met in this beautiful space. And yet we as a global health community face greater challenges and changes than we have done since the Second World War. I don't say this lightly because for health practitioners and policymakers, any epidemic or pandemic would present a more memorable chronological marker. But geopolitical fragmentation, armed conflict, and a fundamental questioning of multilateralism mark an epochal change. It is thus very timely that today our members and those engaged in the Global Health Hub's communities, as well as the greater global health community, have the opportunity to take the global health system's temperature, help diagnose the most pronounced ailments, and offer options for therapy or rehabilitation. One person who has actively supported a healthy lifestyle for global health for more than 10 years is our first speaker. And I would like to warmly welcome the Parliamentary State Secretary to the Federal Minister of Health, Dr. Georg Kippels. Welcome. It is almost unnecessary in this room to introduce you, Dr. Kippels, but I will do so anyway. Dr. Kippels was recently elected for the 4th time as a member to the German Bundestag for the Rhine-Erft district in North Rhine-Westphalia. From 2013 to 25, he served on the committees on health and on economic cooperation and development. In 2018, he also joined the then newly established subcommittee on global health as speaker. For the last election period, he was chair of the CDU-CSU parliamentary group of the Committee on Health. And I'm particularly happy to welcome him here to officially open the Global Health Talk because he is a former member of the steering committee of the Global Health Hub Germany. So let me also take this opportunity before I hand over the baton to thank the Federal Ministry of Health for financing the Global Health Hub Germany and our events, and the Federal Ministry for Economic Cooperation and Development for providing travel support towards the pre-launch of the Lancet One Health Commission report this afternoon. But now, over to you, Dr. Kippels. We look forward to hearing your speech. Thank you.
Dear members of the Global Health Hub Germany, distinguished guests, colleagues. I'm delighted to open this year's Global Health Talk in my new role as Parliamentary State Secretary. This is the first Global Health Talk since the new government and the new leadership of the Federal Ministry of Health took office. I'm deeply honored to serve the new administration and warmly welcome you to this forum on behalf of the Federal Minister of Health, Nina Waken. This is a global health talk that takes place in truly challenging and transformative times for global health. Major shifts and disruptions raise fundamental questions regarding the future of global health, its financing, its architecture, its governance, and multilateralism in general. At the same time, finding joint solutions for global health issues is more important than ever. I'm looking forward to today's panel discussions that will focus on some of these questions. It is timely that the Global Health Talk continues to bring together renowned global health experts from various stakeholder groups. The Global Health Hub Germany continues to intensify dialogue and cooperation in global health and serves as a bridge between civil society and political space. The valuable expertise of all you informs political decision-making. At the Federal Ministry of Health, we are glad to support this important effort. Personally, I have collaborated with the Global Health Hub Germany as a member of Parliament, we heard it, in the past, and including as a member of the first steering committee. And I'm committed to continue supporting the Hub's work in facilitating the dialogue around global health in my new role. Global health is under immense pressure. Multilateralism is being challenged as never before. Declining budgets have created a new reality. We need to adapt to this new reality and continue working together on the health challenges that impact us or could impact us across borders. We face an unprecedented financing crisis in global health. The decision of the US to withdraw the WHO and withhold funding from UNAIDS has had a major impact on the global health community. Resources are even more limited than before. The crisis threatens the ability of global health institutions to fulfill their key mandates and missions. Without a doubt, disruptions in financing are already having a devastating impact on health around the world. For example, if there is a complete halt to US funding for HIV treatment and prevention, UNAIDS estimates that there could be an additional 6 million people newly infected with HIV in the next 4 years up to 2029. And there could be additional 4 million people who will die as AIDS-related illness by 2029. At the same time, this crisis serves as a catalyst for long-needed change. It provides the stimulus to rethink and transform the fragmented global health architecture and to build a more resilient, efficient, and equitable global health system based on a true collaboration of institutions, not through their competition. The landscape of global health is likely to change dramatically over the next years. Germany stands ready to help in making it more sustainable, responding to the needs of the international community, health systems, and individuals alike. It's our view that the World Health Organization should play a central role in shaping the future global health architecture. In response to the financing crisis, WHO has already advanced reform efforts to contain costs and refocus on its core mandate and functions. Restructuring and reforms require tough decisions. But these are necessary steps of WHO is to emerge from the process a stronger and more efficient organization. Germany has been actively advocating for bold reforms, both in terms of sustainable financing and governance. We will continue to support WHO on this journey and are committed to doing our part to further strengthen the organization through political, financial, and technical support. We need a strong WHO. As you all know, Germany has been a long-standing supporter of WHO and a strong advocate for global health. On behalf of the Federal Minister of Health, I would like to emphasize that this commitment remains just as solid under the new government. And let me assure you, I'm personally committed to supporting the global health agenda in my new role as well. To underline this ongoing commitment, as her first official visit abroad, our new minister attended the World Health Assembly. The minister also plans to represent the German government at the UN high-level meeting on non-communicable diseases in September. We are also pleased to see that NCDs and mental health in particular will be at the focus of one of today's panel discussions. Despite the current challenges in international health cooperation, there are also strong signs that global solidarity still exists and multilateralism still works. It would therefore like to conclude my speech on a positive note. After 3 years of difficult negotiations, member states have reached a consensus on a pandemic agreement. This is a great achievement which shows that consensus can still be found even in challenging geopolitical landscape. While we would have welcomed stronger provisions, particularly regarding prevention, we see that agreement as a crucial step towards better cooperation in the face of future pandemics. However, the work here is not yet complete. Establishing an effective pathogen access and benefit sharing (PAPS) system as a core element of the agreement will be essential to the successfully concluding this process. We are just as committed at the upcoming PAPS Annex negotiations as we were when we put our energy into negotiating the framework agreement, and thus are doing our part to make this a success. Global health is always evolving along with the broader changes in the world. When we adopted the global health strategy of the German federal government, we also planned a midterm review this year. We believe that, as policymakers, we need to ensure that the focus of the strategy's priorities still suits the times and remains fit for purpose. To that end, the German government will consult once again with relevant stakeholders, including non-state actors, to gather their perspectives on the changing global health landscapes as well as Germany's role within it. Last week, in cooperation with the Global Health Hub Germany, we launched another online survey for non-state actors. I can only encourage you to participate and provide your perspective. It will remain open for 1 more week. Let me end by saying, yes, these are indeed challenging times for global health. But let us take up the challenges, join forces, and truly collaborate to shape the future of global health. This forum, the Global Health Talk, and the Global Health Hub provide the space to do exactly that. And of course, the Global Health Hub is only as strong as the agreement on its members, the agreement of you. Therefore, I thank you all for your commitment and for your participation and cooperation within the Global Health Hub Germany. I wish you a successful day with exciting discussions. Thank you very much.
Mm-hmm.